Welcome to the Village Talks. This is a space where physiology meets lived experience, where we talk honestly about the body, the nervous system, relationships, and the real questions families are asking without fear-based narratives or a one-size-fits-all answer. We're your hosts. I'm Dr. Jaimy.
And I'm Dr. Brittany. We're chiropractors, perinatal specialists, and humans who work closely with families through preconception, pregnancy, birth, postpartum, and early parenthood. Whether you're preparing for pregnancy, currently pregnant, newly postpartum, raising a little one, or supporting someone who is, you're in the right place.
Let's get into today's conversation.
Hello, everyone. Welcome back to our podcast. Today we are talking about some of the common questions that we get. We're going to do the 10 most common questions that we get in practice in our clinic, not just between myself and Dr. Jaimy, but with our other practitioners that we have in the clinic. And it is a compilation that if you ever have anything else to ask, always drop them in the comments. We read them, we look at them, we want to answer them with all of our episodes. So just drop those in if you have any other questions that pop up after this conversation. The first one that as chiropractors we always get is chiropractic safe during pregnancy? And in my opinion, the answer is yes. And it has to be with somebody who is trained and knows what they're doing. What about you?
Yeah.
Short and simple for me.
Yeah. Short, easy answer is yes, it's absolutely safe. That being said, there are always some considerations, contraindications, and things that we want to think about, right? So we say there are always two absolute contraindications. One is active bleeding.
Yeah.
Right? If you're actively bleeding in pregnancy, that's not great.
Nope.
You need to be assessed by your care provider. That not only is that not something that we can help with, but you probably shouldn't just be out and about living your life not getting checked if you're actually bleeding in pregnancy.
Yep.
So there have been instances where we do have patients have things going on that's resulting in super sporadic bleeding. One of them, I can think of one patient that randomly had like not a cyst, I can't even think of what it was called, but it had nothing to do with the pregnancy. And so she was fine to come in and get adjusted.
Yep.
So if there's active bleeding, we do need them to be cleared by their care provider. And the other one is if you're on active bed rest. Like if you've been told like you need to stay in bed and you should never leave your house, well, we're not at your house. Usually those patients are getting permission to come and get adjusted. Because if you are stuck in the bed and you can't exercise and you can't move, like your body's not going to feel great. And so it's not necessarily dangerous. We just want to know that it is going to be safe for them to come in. Yeah. Other than that, especially with us, right? Like we are trained. We know how to look for red flags and yellow flags in pregnancy. All of our adjustments are gentle. They're very specific. We are taking all of the unique aspects of pregnancy into consideration when we are caring for you.
And that's what I mean too, of like, yes, if they're trained, because not everybody, when we come out of chiropractic school, yes, it is within our scope to work on and adjust in pregnancy, but understanding all the nuances that go into pregnancy and understanding if there's active bleeding, here are the things to do. And here's what you need to do with your provider, the questions you can ask, like that's a different level of understanding where I say yes. And we want it to be with somebody who understands this and knows what they're doing, because not everybody does. And that's okay. And there's things that happen in practice where we're like, oh, I don't really know what that is. But let's figure it out. But it doesn't necessarily mean that we don't have an idea of all the things that are happening in pregnancy.
Yeah. And I think that's, for me, that's really important as I bring people onto the team and we look at ongoing training for our team, is that each person has the level of training and certification that's available to them for their discipline. Then there's this much broader understanding of the nuances of pregnancy itself. Right. So this comes up frequently where, with massage, for example, we have people who have essentially uncontrolled hypertension, right? Like they're experiencing gestational hypertension. It's not entirely uncommon, but they're also on medication and they're also walking around and their blood pressure is still too high for it to be safe for them to receive massage. And what we hear like, oh, my doctor said it's fine, or, oh, I had massage in my last pregnancy and that was my blood pressure. I'm like, I get that. But here's the thing, right? We're moving fluid, we're draining lymphatics. There's the potential that we are putting greater strain on your heart during the course of this therapy. And if your body already cannot maintain safe blood pressure, this is not safe to be done.
Yeah.
And so it is understanding all of the different unique things that we are faced with in our bodies in pregnancy, understanding the nuances of how those impact the safety of each of our different disciplines. So that's where, yes, the training and the certification is really important, but it's not just about, well, how does this person adjust a pregnant body? They also have to be able to take into consideration the things that are outside of our scope to diagnose and treat, but still impact the safety of what we do in our office, right? Absolutely. So it's got to be a big, complete picture. Yep.
And especially like when it comes to chiropractic, there's lots of different
techniques,
styles. That's the word, styles, ways of doing things, but like over 300. So that also goes into it as well, of not that any one of those is inherently unsafe. And the why we do it the way that we do it, and why we pull from so many different techniques, is because there's not one technique that works for one body consistently. We need a myriad of things in our toolbox to be able to support who is on our table and the specific system that is on our table, to be able to figure out or help them figure out what is happening, why is it happening, this is the understanding, here are some things we can try. Sometimes it works, sometimes it doesn't, and then we pivot and find something else that can try and work and help.
Yes. And I think, I know for myself in practice, I'm very impatient. Relaxin works with us in early pregnancy. And it does mean that we can often see really big changes in a short amount of time. But I'm also, we're not going to do the same thing week in, week out, because we only have one technique and just be like, oh, well, we just have to be patient. It'll work eventually. No. In pregnancy, if you're doing what the body needs, it should work relatively quickly. And if it's not, you need your provider to have some alternatives or be able to pivot or refer you out because you deserve to see results. Absolutely. Right? This is finite. So you can look at that on one hand of like, well, I'm not going to be pregnant forever. I'll suffer through it. Or you can look at, we only have 40 weeks of pregnancy. We're not going to wait 20 weeks and see if this works, right? Like we want to give it maybe 2 or 3 weeks. And if it's not working, then we need to reevaluate, right? And see if there's something else we can be doing. I always tell patients, I'm never holding back. I'm never like, well, I'm not going to do that trick until visit 5. No, like it's, I sometimes we can't just come in, guns blazing and throw everything at a body because that's too much and it can't handle it. So you do have to kind of get a sense of what is this, how much work can I do? How much change can I make in a short period of time without overstimulating or overtaxing this body? But there's no, I'm just going to try this. And if that doesn't work in 4 weeks, then maybe I'll try this secret thing that now, like we're always trying to do what we can, as quickly as we can. I think that's one of, to me, that's one of the important things. And it is an indicator of whether or not your provider is specialized in the unique nature of pregnancy, because it's not like there's this one set of ground rules for pregnancy. Every time you see a pregnant patient, their body is different, right? Baby has grown, relaxin has increased. Every time they're on your table, you have to reassess, right? Webster, we reassess Webster every single time the patient's on the table. So that is often different than how a lot of people practice outside of pregnancy, where we're operating off of a set of x-rays and we're doing the same adjustment over and over, or we've done a scan or something else. For me, it's a little bit of like, no, let's see what we find today. And that's what I say to patients when they lay on the table. Like, let's see what we find today.
Get to be Nancy Drew.
Yeah, because your body's different than it was a week ago. So you have to have the knowledge and the ability, the willingness to kind of, flex and pivot based on what you find that day, what the patient's telling you that day, what they need, what's going on. Their kid was sick, they tried a new exercise, they traveled for work. I mean, those things impact everyone outside of pregnancy, but the body's ability to tolerate that kind of stuff and compensate for it is significantly diminished in pregnancy. So really minor things can throw people off really fast.
Absolutely.
Yep. So you can't just do the same thing every time.
No. Yeah. Awesome. Well, great question. Which also leads into the next question that we frequently get asked is, when should I start prenatal chiropractic care?
Yeah, I mean, it's never too early.
I know.
So we are fortunate enough to have a lot of patients who remain with us after babies arrive, or they come to us the first time with an issue postpartum, and so then they're already seeing us with some regularity before they get pregnant again. So we do have some people who are starting with us at 5, 6, 7 weeks.
Yeah, I had 2 of those.
Thankfully, most people aren't experiencing issues that early in pregnancy that necessarily prompt them to think, oh, I need to come in for this. But we do have a lot of people who, through their previous pregnancies, through referrals by friends or other providers, now have an understanding of the benefits of chiropractic care in pregnancy. And a lot of the great statistics that we have are based on patients receiving care throughout the pregnancy. There isn't an exact number for that. But I always say, like, pain isn't normal in pregnancy. You can expect to be uncomfortable in third trimester, but if you are experiencing some level of discomfort or some pain sensations in your body that you didn't have prior to pregnancy, I don't care if you're 9 weeks pregnant, like, it's not normal. It's probably not anything severe or big and scary, but it's like your body is changing, and it's already telling you that there is something going on here that is not going to serve us well for the rest of this pregnancy.
Yeah, it may have served us prior to, but now that our body has to change and adapt, I can no longer continue this pattern.
Yes, whether it's a joint, whether it's a muscle, like there's some tissue that is like, I don't like this. And you're going to keep being pregnant. So let's not have that issue persist through the pregnancy. So if at any point you're experiencing pain or discomfort, that's the time to start. If you are coming in for general wellness or because you have heard about the benefits of chiropractic care in pregnancy, best case is we're starting early to mid second trimester, right? Like, we do get a lot of people who are like, oh, I heard it's good to get adjusted in pregnancy. I'm like, it is. We get 38 weeks. And so, we will always do what we can with the time that we have. But if you had this issue prior to pregnancy, if this is from an injury when you were a teenager, or, 10 years of playing sports, or, we have a pattern, it's hard to resolve those patterns and release those tissues and make big changes to your alignment in 1 or 2 adjustments. We can do that faster in pregnancy, but relaxin doesn't affect all the tissues. So the more time we have, the better. So it's never too early and it's never too late. But I think if you really want to experience the benefits that are available with regular care, then we're starting probably around 20 to 24 weeks.
So like late first trimester, early to mid second trimester. Like, especially for wellness stuff too. I mean, we had one patient who she had like hyperemesis the entire pregnancy. And so she would come in every other week and she would just be like, this is the only thing that's keeping me sane. And she started coming in like, I don't know, she was 8 weeks when we first started seeing her. And she was like, this is what is helping my body feel much better. And then in third trimester, we started going weekly because she was like, I just need to get through it. Like all I'm doing is laying on the couch because I can't really do anything else. And I was like, we will do what we can as best we can.
We had a patient last year who came in third pregnancy and 5 weeks. She was like, I'm here. I was like, okay, great. And she was not under our care in her previous 2 pregnancies, but she had gestational diabetes. She has, just a number of issues that existed prior to pregnancy that are exacerbated by pregnancy. And she's like, I really would like to try to keep my blood pressure under control, see if I can not develop gestational diabetes this time. And then physically keep feeling good because I have 2 kids at home. And that was the case. We co-managed with acupuncture. At no point did she have a high blood pressure reading. She did end up having some blood sugar regulation issues, but they stayed manageable with diet. She didn't need to go on medication for that. Those were 2 of her goals. And she really physically felt pretty great through the pregnancy until about 35, 36 weeks. Like, to have your third pregnancy be your healthiest, best pregnancy isn't what most people tell us they experience. So, yes, she was committed to care. She came in regularly. She took our home care recommendations, and then she kind of like reaped the rewards and had a really, what she felt was a really, really great pregnancy.
Yeah.
And so we're happy to be part of that.
Absolutely.
And to be able to help patients meet those goals.
Yeah.
But it usually means probably starting a little bit sooner than I think most people are waiting for a problem, right? Or they think, well, I don't have pain. I don't have anything that they would traditionally think of chiropractic care for.
Yeah.
And I'm like, yes, if that's happening for sure, we're a great option for natural pain relief, but there's all these other benefits too.
Yeah.
And where you really see the birth prep benefits and the shorter labor is when we're starting early second trimester.
Yep.
Yeah. Because we've got 20 plus weeks to sort of release and unwind these long-standing patterns in your body so that we can take advantage of the dynamics of your pelvis and sacrum.
Of course. Yep. Which then, leads into, the next question that we're commonly asked is, how often should I come in during my pregnancy? Which is, I love and hate this answer when I have to give it. And it's usually like 98% of the time my answer is, it depends.
It depends. It does.
Yep.
I mean, I constantly vacillate back and forth between assessing every single body separately and individually and wanting to be like, okay, well, this is really what I think you need today. But also every time you come to me, it's a different body. And so it's this like, well, now it's a week and now it's two, and it kind of bounces around. That's hard for people.
Yeah.
I do think that patients appreciate having some predictability. And so we do our best to do that. And then also doing this for 22 years and only focusing on pregnancy now for over 20 of those 22 years, I'm like, yeah, there's some patterns.
Yeah.
And so, yes, I want this to be very customized to what's going on with you, but I also know that if you stick to, twice a month and then once a week, like you're going to get all the things that are possible.
Yeah.
I think for some people it can feel a little bit, I don't know what's the word I'm looking for? Like we don't want it to just be this standard protocol or regimen for every single patient because their bodies are not the same. That being said, there are a lot of things in pregnancy that are very predictable when it comes to the musculoskeletal system.
Yeah.
So I think it depends. And what I would tell people is like, the good news is that every person that comes into us, you're getting a blend of both. We have this regimen that we know works really, really well, but we also want to customize that in a way that helps you meet your goals. And we are going to take into consideration, how far are you traveling to see us? We have patients that travel an hour plus. Are there certain days of the week where you have childcare? Like there's also all these other things that have nothing to do with our recommendations that impact patients' ability to even come in at the frequency that we've recommended.
Yeah. I mean, I just learned that we have one splits time between here in California and the other one splits time between here and Wyoming. Like we have people who are coming in and I'm like, okay, it's not going to be as frequent as I would like, but we're going to do what we can while you're here.
Yes.
Yeah.
And sometimes it's doing a longer visit because they're coming in less frequently.
Yep.
So we're trying to accomplish more in the time that we have with them. So it depends.
It depends. I know. I would say like our typical wellness, what it looks like is in first and second trimester, we're basically coming in every other week. So twice a month. And then around that, depending 34, 35, 36 week, what's going on in the body, we might start going weekly for birth prep. Yeah. And that's, I would say, pretty typical. The other stuff, right, is like if it's acute, great. We're going to tailor it differently.
Yep.
The more individualized stuff too comes with all of our home care recommendations.
Yeah.
We're not giving everybody the same take home care because everybody's different. And then same with supplements or vitamins or things that are going on with blood pressure or blood sugar and things like that, right? When we're co-managing with other practitioners too. So that's where it's really, really tailored. I would say, and the frequency and consistency changes. Yep.
We have a framework, right?
Yep.
We're always working from this baseline framework of what we know works well for keeping your body feeling good, helping to facilitate optimal fetal position, and then setting you up so you're not going to run into physiological issues during your birth.
Yeah. Yep.
And then that, based on that framework, there's flexibility for each individual.
Absolutely. Yeah. Yep. So great. Yeah. And then we've kind of touched on this in our episode when we were talking about Breech. But I think we can dive into a little bit more, because talking about the body work and the chiropractic side of things, especially, is the other question that we get asked a lot. And this is kind of, I think, like a buzz in the birth world currently.
Yeah.
Is, can chiropractic turn my breech baby? Oh, yeah. It's a deep one.
So we don't turn babies.
No.
We are not OBs.
Nope.
Only OBs really should be doing that under close monitoring and ensuring that mom and baby's heart rates are stable. For chiropractors specifically, and I would say like body workers in general, and there are yoga teachers and movement teachers, there are people out there. We've got spinning babies practitioners. There are a lot of people out there who have a lot of tools to help create space in the body and facilitate baby turning themselves head down without intervention, right? Without that ECV. So we don't. I mean, I don't know of anyone, and I hope there aren't any chiropractors out there who are putting two hands on a baby and trying to force them into the head down position. I think that it's just comes down to language, right? It's the nuances of language, right? So we don't actually turn them, but what frequently happens is babies turn on their own after receiving our care.
Yeah.
And so that is our goal, right? Babies are going to take the space that is available to them. We are trying to create more space. Are they stuck up in your ribs, or can they not get down in your pelvis? Where is their tension? Where is their restriction? And it's all about removing those obstacles so that baby can follow their instincts, their giant heads compared to their skinny little bodies in this zero gravity environment. Like, yes, it's trying to create the opportunity, make sure that mom's posture supports baby turning, make sure that mom's gravitational positions support baby turning, make sure that how she's breathing, contracting, relaxing the pelvic floor. Are we activating our abdominals all day long? That's all of the homework awareness stuff on top of us actually manually releasing joints, releasing tension from ligaments, tendons, muscles, creating alignment. It's all of it is just to get everything out of the way so baby can get where their instincts should tell them that they want to go. Because even their instinct may be breech.
Yep, absolutely. They choose it for a reason.
Yep.
And sometimes that reason is because there's limited space. And if we can create more space, then they're like, oh, yes, thank you. This is where I wanted to go. And I'm going to take that space. Like, I've heard it described as like, oh, I woke up and things just felt different. Or it was a very violent movement that happened and then they were head down, or that's what they feel when they go head up, right? So it changes depending on what's going on. And sometimes instinctually that is the position they need to be in and what they choose. I always say they have the inside scoop that we don't, because literally they are inside knowing everything that's happening. And we're, guessing as best we can in a very we have the understanding of certain things, but also still we don't have 100% of the information.
No, I mean, we can't, we are making educated guesses with our highly trained hands about what's happening on the inside from the outside.
Exactly.
Right? Like we're trying to get a sense and get messages from these tissues. It's not always super clear, or sometimes they're mixed messages, or there are going to be, it's a very, very, very small percentage of babies that should be breech full term, right? 1 to 3%, which is actually a massive swing, but that's usually what the statistics say. I think it also explains why this type of work works so well, right? Because if we've got 5% of babies that are still breech at 36 weeks, right? And then we're doing all this body work, and then they do go head down, in the next week or two. So it's a matter of anything more than 3%, and honestly, probably much more than 1%. That's not their instinctual safe position. That's an obstacle. And so when we remove the obstacles, then they go head down.
Yep.
Like that's just it.
Yep.
Like there are always going to be times where there is something physiological and baby knows the things we don't know.
Exactly.
But we don't know that until we try.
Yep.
And like 90+% of the time they go head down.
Yep.
So
Yep.
it was the obstacles, not, the physiological barrier.
Exactly. Yeah. How I describe it. Usually on like first visit, if I don't do it first visit, I'll do it second visit with our patients is like, have you ever seen the movie Step Brothers? Remember when they turn their beds into bunk beds and they're like, so much room for activity. Yes. Like that's how I describe, that's what we're doing for baby in your pelvis and in your body. Because if there's limited space, there's limited movement and like
there's limited room for activities.
Exactly. And so when we open up and create more space, there's going to be lots of more room for activities. And the majority of the time they want to go head down and they will. Yeah. That's how I describe it.
It's perfect.
It bleeds into the next question. And because majority of our patient base is working with pregnancy and postpartum, I would say the next question, I wouldn't say it's fairly common, but we do get it a lot of, I did all this work and my baby still didn't flip and I ended up having a C-section. Why?
Oh, that's the big question, right?
Yeah.
That was my big question.
Yeah. Which is why I think you're great to answer this question.
Rarely do we find out. I mean, it's actually pretty uncommon for somebody to come back who had a breech baby either via C-section or vaginal birth and have a clear answer on this is why my baby didn't turn.
Yeah.
So I don't know. And I try to preface that for them. Like if we're seeing babies aren't turning after that, like, in our office, most babies are going to go head down between the second and the fourth visit. Sometimes it's one, but I'm like, don't necessarily expect that. Usually it takes a little bit of time to create some space. If we get to that fifth or sixth visit and baby still hasn't turned, then it's kind of like a reassessment of like, all right, so here's what we found and what we're working on. Are those issues still there and we need to continue working on them? Or have we kind of released what there is to release and we just got to give this baby some time?
Yeah.
I think, when they start asking and it's like, we're never going to know before they get here. We might get the answers afterwards, but also we're probably never going to know.
Yeah.
And that's really hard. And I do always hope that there's some peace of mind for them. I had peace of mind of like, I literally did all the things right. And she was still breech.
Yeah.
So for me, there was peace of mind in knowing like, this is just, I have to trust her instincts. I have to trust that this is the way that this process is supposed to unfold. I did all the things that I could do. I had all the information that I could have. I think, for some patients, they didn't have all the information until they did. They wish they'd known sooner, or they didn't know that there were all these things that they could have done before they found out baby was breech. I think that's sometimes where, as women, as moms, as parents, it's got to be our fault. We, play the blame game on ourselves.
Yep.
And it, my baby must be in this thing that's not considered optimal because of something I've done wrong.
Yeah.
And I'm like, I don't think we should ever be blaming ourselves, but if somebody's like, if you do this, your baby will be breech, and you're like, I don't care, I'm doing it anyway. Okay. That's not what's happening.
Yeah.
Right. Everybody's doing the best they know how with the information they have. If you learn more information, then do differently, do better.
Absolutely.
But you can't beat yourself up for not doing what you didn't know that you needed to do.
Yeah.
And I think that's where I'm so passionate about trying to educate people, start asking patients, like, do you know where your baby is? Is anyone checking? We want to just start monitoring, not because we need to panic at 32 weeks if your baby's still breached. That's pretty common, but it's just a check-in. It's just an understanding of it's never too early to start working on this stuff, right? Patients who've had a breech baby, statistically, you are more likely to have another breech baby. We don't wait till 36 weeks to see where that baby is.
Yeah.
Like, let's figure out what's going on in your body. Let's make sure that you're doing all the stretches and you're doing the movements and you're really cognizant of your posture and all the things that can contribute to baby not being in a good position. Let's just live that way every day. You're going to feel better too.
Absolutely.
And so, there isn't an easy answer. Every once in a while, there is. There's there was a septum in there that we didn't know about.
Or
like
there's a fibroid or something.
Sometimes those things are there. Most of the time, we don't get the answer, which I know is frustrating. But I always hope that patients can find some peace of mind in doing what you can, right? Taking control of what is within your control and then not placing self-blame about the things that are out of your control.
So much easier said than done. Yeah. But I mean, and that's what I really love about how we specifically do care, right? I can't speak for anyone else who does it, but for us, the clients who have come in and, they said, I just want to do everything I can to give them the best opportunity. And if they turn, awesome. If they don't, I know, and I have the confidence and empowerment that I did everything potentially that I could, right? With the information they had at the time, blah, blah, blah. There's lots of different conversation about that. But the one thing I do hear is like, baby hasn't turned, so we're going to schedule a C-section, but the numbness on my leg is gone and I didn't know that could happen. Or I'm sleeping better throughout my pregnancy and I wasn't really expecting that. I thought it was just something that happened, that I was just going to be up 4 times a night and things like that, right? So we do see positive benefit.
Absolutely.
Despite the fact that even if their main goal was getting baby to flip and go head down, right? So there's still so much benefit of consistent care like that.
Yeah. And I think, what we call our Breech protocol is the highest frequency of care ever in the office. It's the only time we ever see people 2 days in a row. Right. So we are trying to make really big changes really fast. And that usually also has people being like, wow, cause they'll come in and be like, no, I mean, I feel fine. Like I'm here cause baby's breech. And they come back and they're like, yeah. So apparently I had raging low back pain that I had just gotten used to because it had been building through the pregnancy or yes, I slept through the night last night for the first time in 3 months, yes, there are other benefits and they're always thankful for the other things that they're experiencing in their bodies, even if that primary goal wasn't met.
Still very empowering. So then I would say that's most of, I would say some of the pregnancy stuff that we get. The other half of it of what else we do in the office, right? Because we're not just pregnancy, we're also postpartum. We also do infant pediatric care and whole family wellness. Yay. Does my baby need to be adjusted and why?
As time has gone on, and I think after having my own kids, it's made it a little bit easier for me to explain it because parents are like, they're new, they're fresh. What could they possibly need chiropractic care for?
They're not in pain.
Right? And I'm like, look, no matter how easy or natural or beautiful your birth is, that process is traumatic on an infant spine and body and nervous system. Most of the time.
It's a lot of pressure.
It's a lot of pressure. It's a lot of dramatic changes in pressure between contractions. It's a lot of compression. And it is a process that is designed to happen exactly as it can happen. So it's not to say that, this easeful, beautiful water birth where, mom felt strong and empowered and, baby came out of the water and was really calm. It's not to say that baby has trauma and that baby's going to have a whole lot of problems if they don't get chiropractic care. But I also firmly believe that if every baby got checked, oh my gosh, there would just be so much less of everything that parents are dealing with their newborns. And so it's just, we say we do a newborn assessment, right? They may not need an adjustment. This isn't a really, really complicated, head to toe exam and blood work. And no, it is hands, our trained hands on a very sensitive little body, right? And are all the cranial bones moving? Because they all had to overlap to come through. Even if you had a C-section, but if your baby was head down, we've got cranial overlap, right? In preparation for that process. Your body doesn't know you're having a C-section. Your baby doesn't know you're having a C-section. We still have to assess the cranial bones, make sure that they're moving so that we don't develop a flat spot by 4 months, right? We need to assess the nervous system and make sure that we don't have tension, not just through the musculoskeletal system, but through the nervous system, because that's going to impact sleep. That's going to impact digestion. That's going to impact feeding, right? Those are the only things your baby does. They eat, they sleep, they poop. If any one of those 3 things isn't happening easily for them, not only is that hard for them, that's hard for you as new parents,
Yeah.
right? It's impacting your postpartum experience and laying the groundwork for your level of stress as a new parent.
Yeah.
So it is a relatively quick and easy assessment for us to feel through this baby's body and very quickly identify. And sometimes we go through, I'm like, oh, there's a little bit of tension here. And we go through and I go back and I'm like, all right, well, we need to adjust this area. And by the time I go back, there's no tension left. Just even in the assessment, sometimes that's all it takes is just fingers in the right spot, or a baby who's like, yeah, okay, yeah, that feels good. And then that's it. Like it is so gentle. I think it is so different than what parents, most people expect and think of for chiropractic care. But I tell parents, like, they may not need it. There may not be anything we find that needs to be adjusted or needs to be treated, but we don't know unless we check. There's never any harm in checking. It's a very, very gentle process. We are always going to walk you and talk you through everything we find before we ever do anything in terms of treatment or adjustments for your baby. And, we have parents who bring every one of their kids back because they'll bring in their third kid and they're like, I mean, I also have 2-year-old and 4-year-olds. Like it's never too late. Bring them in, like because they'll be like, oh, they had this. My first two were super colicky, and this baby's not, right? And this is the only thing that's different is that I got them checked and adjusted when they were born. So we do not deal in big and scary. We deal in really subtle things, but those subtle things can make a really big impact on their first few weeks earthside and what that looks like for your family as a whole.
Yeah, absolutely. And I always remind them that none of this is good nor bad. If we do find stuff that we could work on in terms of the body work and what needs to be adjusted and what we're looking at, you're not doing anything wrong. You did nothing wrong in any of this process. They are learning new skills. They are learning movement. They have these primitive reflexes that we did in another episode. But those are all impacting, and now they're in a new environment. They had a completely crazy experience with birth. And so all of these things go into each other and they bleed into each other. And we say in our office, babies don't grow out of patterns, they grow into new ones. And so really making sure that as they're growing into these patterns that they're doing it really well. We want to set up optimal function because that's going to just bleed into all of everyone's lives in a really positive way. It's going to make them be able to handle different stressors a little bit better when it comes to their nervous system reset. It's going to help with a lot of other things that have just been deemed, oh, well, they're just a fussy baby. It's their personality. No,
they don't want to be
fussy. They want to be open and calm and, responsive and relaxed. And those are all things that, body work, chiropractic, cranial sacral, PT, OT stuff, like it can all be really impactful. And the earlier we do it, the better.
Yeah.
While they're squishy bits.
Yep. I think, just existing out here in this environment is a lot for us as adults who have nervous systems that have learned to adapt.
Yeah.
They have gone from this dark, quiet, zero gravity environment out here.
Yep.
And they are, I don't know the number off the top of my head of how many millions and billions and trillions of neurons they're building, right? In the first 3, 6, 9, 12 months. Like it is just a lot to exist in this environment every day, right? It is a lot on their nervous system. So when we have babies who, get fussier as the day goes on and they have a hard time settling them, like they're overstimulated, not because you've done anything wrong, but because their sheer existence is overstimulating to their nervous system. And the more we can help them adapt and, ingrain everything that's coming in and have it become part of their daily life, like body work helps that process happen more consistently. So they don't reach overwhelm. The stimuli is still coming in, but they're able to take it in, they're able to learn from it, they're able to continue to grow and adapt. It facilitates that process.
Absolutely.
It doesn't mean nobody has a bad day. It doesn't mean they can't get constipated, like stuff still pops up.
Life happens.
Yes, but then that becomes the occasional, it doesn't become their norm and their baseline. Right. And I think that's something we see really often is parents being told like, oh, it's, it's normal to poop once a week. I'm like, no. I'm not saying your baby's got an intestinal blockage and needs surgery, but also like, how do you feel when you poop once a week?
Yeah.
Right? Like, it's not the sign of like a healthy functioning, optimally functioning digestive system.
Yeah.
When we have babies who are like, well, they only ever take a 30-minute nap. Yikes. Like, that's hard for both of you.
Yep.
So I'm glad that they're sleeping for 30 minutes, but really we need to be at an hour for a nap. So what can we do to support the system so that their nervous system can get into that rest and digest state?
Absolutely.
So it's about optimal function, right? Is your baby going to survive without chiropractic care?
Yeah.
Almost certainly, yes. But are they going to function better? Are they going to reach their potential with it? Yeah, this is something pretty easy and gentle that we can do to just support their system as they're going through these massive growth spurts and hitting milestones and all the changes and all the nervous system development.
Yep, absolutely. Yeah, which bleeds into the next question of, whether we saw you throughout your pregnancy or not, like, when should I come in postpartum? When do I bring myself and my little one in for care in postpartum? Which is differing opinions, but I really love how we do it for us.
Yeah. I mean, for me, this is part of why we exist as like a wellness center.
Yeah.
And why I have always opted to exist in a collaborative environment in terms of my practice, because I was lucky enough in my pregnancies and postpartum periods to have resources because of what I do, because of building a professional network of other birth workers and people in this world. But a lot of people don't have that. And so I think for us, we have a really unique opportunity to fill the gap between I've had my baby either at home and I've had a 2 or 3 day visit, or at a birth center or a hospital, and I've gone in for, most of the time there's a check-in, at least a phone call or something. But really the first time you often are face to face with anyone in any realm of healthcare is at your 6-week postpartum visit. Yeah. And I think a lot of parents, they would say those were the hardest 6 weeks of their lives, right? They're the most transformative. And then even further back, I think the first 2 weeks are really, it's all of the early healing. It's all of the newness of feeding and keeping the tiny human alive. It can be wildly overwhelming for most parents. Yeah. And so that 2-week window is where we try to begin having an impact. We recommend returning within 2 weeks. 2 weeks is kind of our guideline for postpartum checkup for you and newborn assessment. And it's because we are screening for all of the things that have the potential to get worse, not better, by 6 weeks, by 3 months, by 12 months. And so it is, if you're experiencing musculoskeletal pain, if the reason that you saw us during your pregnancy is not resolved in a couple of days, absolutely come in sooner. Yeah. You should be able to sit. Is it going to be comfortable? No. But if you're like, I can't even sit because I have terrible tailbone pain, do not wait 2 weeks or 4 weeks or 6 weeks. Get in, let's figure it out. A lot of times that is kind of like a one and done adjustment, right? And the issue's resolved. Or if we are seeing, I have had 2 and 3 day old babies who have not had a single successful latch. Yeah. It's like, we do not wait. Nope. Right? You bring them in 2 to 3 days. Those are longer visits, and usually babies latching before they leave. Yep. So there are some exceptions to that necessitate a sooner visit. Sometimes things are going well. People are chilling and they're like, I don't know, like all of a sudden it's a month and like we've been good. I'm like, great. I'm glad you're here now. Yeah. You didn't maybe need some of this stuff up to this point, right? And then we have other people who, because they're in such a state of overwhelm, that they didn't get in. Yeah. And it's like, oh gosh, like if we had been able to get you in here in that 2 weeks, we could have talked about feeding, and you wouldn't have had to triple feed for the last 6 weeks and be losing your mind and be exhausted. Or, we wouldn't have I can't think of another example off the top of my head, but
there's a lot.
It's a lot of assessment. It's a lot, we've had conversations where I'm like, no, actually you do need to call your OB or midwife. This is not normal bleeding. Yeah. This is not a normal headache. Yep. This is not a normal amount of pain.
You shouldn't have cracked, dry bleeding nipples.
No. Yep. And so like, you're an IBCLC. I am not, but I was like, you need to contact someone like today. Yeah. This isn't just like, oh, well, I've never breastfed before, so of course this is really painful. No, like here's the range of what's normal. Yep. And then here's the range of what's common that you don't have to suffer through. We need to get you some support. Yeah. So a lot of what we assess for and find in that first couple of weeks is referring them out to someone else.
Yep.
So I'm like, I feel like we are really fortunate because we're in this collaborative environment that we're kind of the screeners, right?
Yeah.
We're like catching things earlier than they maybe otherwise would have been caught, which means that parents are going to get the help they need. They're going to have a better postpartum experience if they have access to the right kind of support at the time where we need this supportive intervention.
Yep.
Like it can still be helpful 2 weeks from now or 4 weeks from now, but you don't have to suffer, be stressed out, feel alone, feel like a failure because you don't know what you're doing and you don't even know who to ask for help or how to ask for help.
Yeah, absolutely. And it's different with every baby, every postpartum experience, every pregnancy, right? They're all so very different. So maybe in your first, everything was going well. And then in your second, you're like, oh my God, I know nothing because this is a completely different human and they're having all kinds of different things going on that I didn't experience in my first and vice versa, right? And I love how you say that, like we're the screeners. And this is where, again, it goes back into the knowing the nuances of this period and why it's really important is because we don't want to miss things if it is big and scary, right?
Yeah. And
we're not practicing obstetrical care by any means. We are not playing pediatrician, none of that stuff, but we have the tools and the training and the resources to say, I'm going to refer you because this is something that needs to be addressed. And here's the person or the provider to go to, or the specialty type of provider to go to, right? It's a really important part and piece of this puzzle that I think, a lot of people don't realize that chiropractic specifically has that training.
Yeah. Yeah, I do. Most of us don't practice primary care. Most of us don't practice, but we get the diagnostic training in school. They're going through pediatric certification. Like you still learn about the different childhood rashes and viruses. Right. And not because, and not because we treat them, but sometimes you're coming in and telling me you have rib pain, but you have shingles. So I need to know the difference because why would I adjust your ribs 600 times for your shingles? So it's also being able to differentiate what is the musculoskeletal issue or nervous system regulation issue that we can help with. And what is something where we need, we exist in the realm of healthcare, but we are not medical providers. We don't write prescriptions. We don't do surgery, right? So it's kind of like a GP where it's like, okay, so I'm the first person you've talked to about this. Let's help you decide, like, is this something I can help you with? Maybe. I love I don't know if this is a chiropractic thing, but I'm like, bring it. What do you got?
Let me know.
And sometimes it is. And sometimes it's like, so nope, that's actually not something I can help you with, but I know what it is. And here's the person or the provider that's going to be able to help you with that.
Yeah, absolutely.
And I don't know, this day and age, I feel like pros and cons to all the specialty and subspecialty and subspecialty care. It can be a lot. It can be overwhelming for people. I think, even for people who were regularly going to like a primary care physician before COVID, I feel like after that, everybody's like, meh, I don't want to go to the hospital. I don't want to go to the doctor. I don't want to be around the sick people. And so I don't know that everybody has somebody in their life that is able to give them an objective opinion about what's happening in their body because there is Dr. Google and, we have such easy access to so much information. So much of it is not accurate and is not good information. And so we try to be sort of that voice of reason of like, yes, I believe what you're telling me.
Not crazy.
Yes. I am concerned about it too. And here's who needs to be in charge of taking care of this for you. Or I'm not concerned and here's why. Right. So like to give you some peace of mind for, I hear what you're saying, and we're looking for this, this, and this. Right. Like I'm not concerned because of this, but if this, and this starts to happen, then we need to reassess. Right. Or if this totally changes or if this, so it's just giving people their own sort of framework. I do feel like more and more people are feeling like they need to be in charge of their own care. And I'm like, it should be empowering, and you should be paying attention to your body, and nobody knows it better than you. But you also are not a trained healthcare provider, so you don't really know how to be objective about what's happening in your own body. You need somebody to play that role for you. When we have patients who are under care, we are often the people they see the most frequently. So I'm like, bring it up. Maybe we can help. Maybe we can't. If we can't help, we're definitely going to find somebody that can.
Absolutely. Yep. Oh, yeah. Such a big conversation, which also then goes into, well, this will be our last question, but it's a big one and we can probably do another episode on it. But when it comes to latch, feeding, infants, all that kind of stuff, is tongue tie, lip tie, cheek tie, all that stuff is it real? Is it necessary? What are the implications? What are you what based off of my experience is telling you that this is a tongue tie when 5 other people said no, or 3 people said yes, but then one person said no, and that one person might be my pediatrician, and now I don't know what to do. And I've heard, dentists and nurses and OBs or pediatricians are linked together and they're giving each other back pay, so it's just a money gamble and all that kind of stuff. And it's like, oh yeah, there's so many different things happening, but it's a very big conversation that needs to be talked about more.
And it has become a bigger conversation in recent years. The conversation's not going away. In upcoming years. It's a much broader discussion in terms of like, why are we seeing more of it? Because we all are. This isn't new. I have a severe tongue tie.
Me too.
Right. So I'm like, it's not a new thing, but it's like anything else. When we discover it, and the more we learn about it, then the more we want to learn about it, and the more we want to do about it. And it's another thing that's not simple. I do think it's probably a whole separate episode. But it's rarely as simple as they have it or they don't. Right? Because tissues can be tied, but functionally everything may seem fine.
And they're flexible, and you have good motility and good lateralization and all things that are required for oral function. Cool.
And we can have babies who have no evidence of ties. And there are severe levels of dysfunction with feeding, with sleeping, with mouth breathing. So it's another one that's not simple.
I know.
But I think that this is a time where I tell parents, this is a time to trust your instincts. So if something feels off, right? If something seems harder than it should be, if your baby seems uncomfortable, your baby seems to be struggling. With a first kiddo, there's always a little bit of like, this is new. You haven't done this. Baby hasn't done this. But if you're seeing the same provider over and over again, and they're telling you everything's fine, but it's not fine, get another opinion. If you have been told by 10 different people that your baby doesn't have a tie, then they need to tell you what's going on, right? Like, it's like, great, my baby doesn't have a tie, but why are we still struggling with latch? Why are they still choking? Why, all of these things, then functionally, we need to help this baby be able to feed better. It's definitely a whole other episode.
I would say baseline though, because we do see a lot of peds in our office. And so it is a very common thing that comes up pretty consistently, I would say. And for me, it's the release isn't the magic bullet, but it can be super impactful and beneficial. It also, again, has to be with someone who's trained and also cares about function and not just only releasing. But the whole spectrum and picture of it is body work and care before and after a release. That is like key factor right there, because if you get the tie released, but you didn't do anything to loosen and secure the tissues around it to make sure that they can also learn and build the skills that are needed for that type of function, then that also isn't beneficial for people. And so the body work beforehand is what we always recommend, and the body work after is what we recommend, because sometimes body work is enough to release those tissues and we see really great success. Sometimes we get to a point and we hit a plateau and it's like, we're not quite where we need to be. And that's when we're like, okay, this is your choice. to go to one of the people we refer to, or to go to who you've been referred to for any type of release and get their opinion, because they have the most knowledge about the mouth.
Yeah.
And so they're going to be the best providers for that.
Yeah.
Outside of your pediatrician, outside of your lactation consultant, outside of us, they're going to have the most training in the mouth. And so go get their opinion. Doesn't mean you have to do anything about it, but see what they have to say and then make the decision that feels best for you.
Yeah. It's understanding the whole big picture, right? And I say this is like another area, like you and I are both trained extensively in tethered oral tissues.
Yeah.
And so I feel like we often play the role of screener.
Yep.
Right? Where we're like, look, a release provider is really the person that is best trained to tell you whether or not they recommend you release it. Yep. Right? I'm like, what we can do is show you the physiological evidence and then also explain the functional component in this body. Because the other thing to consider is how old is this kiddo? Right? Yeah. So if we do have a baby that's a couple of weeks old, then we're kind of ahead of the game here. And so oftentimes the amount of body work that they need pre and post release is minimal. Yeah. But if you have a 4-month-old, a 4-year-old, an 11-year-old, right? We have years of their very intelligent body compensating for lack of mobility, strength, control of these tissues. Yeah. So it can take a fair amount of body work before and after to help the body learn new patterns, correct patterns, release the compensation. And, there's fascia involved that covers the whole body. Like, it's not super simple. The younger they are, the simpler and more straightforward it often is. But as time goes, because they're, feeding is survival. They are going to figure out how to extract milk from a breast or a bottle from a sheer survival standpoint. So now we are often dealing with tension that has been created by other tissues supporting this process, right? If the tongue can't do what it needs to do, the body is going to use other accessory muscles and recruit other tissues to make it get done. Now these tissues carry tension because they've been overworked and overloaded. So it is a really complicated process. And so I do think, we exist in a space where, again, I feel like we live in a bubble a lot of the time, where, we are often co-treating, co-managing, collaborating on these cases with IBCLCs, which has to be in consideration if you're breastfeeding. Absolutely. And then, these specialized dentists who really do a lot of this work and do it well. It takes a team, right? Like, I wish that it was simpler than that, because it is so important. It has such a huge impact on your baby and their early feeding journey. And that's not even talking about all the stuff that comes up down the road if it is there and it doesn't get resolved. But it's not simple. It's not super straightforward. It's not cheap. But I think the important thing for parents to know is that if you're being dismissed, but you still feel like there's something that's not quite right or function isn't quite where it could be, like, make sure that you're seeking out someone who truly specializes. I mean, this is what I say across the board for this, right? Because it can be within, any of this stuff can be within someone's scope, but having somebody who understands the nuances usually means you're going to get results faster. Whatever the results are, you're going to get them faster, which means it's less time. It's usually less money than trial and error with, this lady at work recommended this person, or my neighbor said they like this person. I mean, personal recommendations are always wonderful, but then also do your research, right? And I always say, like, if it's not the main thing on their website, it's probably not their main thing, and that's okay. But especially when it comes to pregnancy, comes to postpartum, comes to babies, like, there are and we're not the only ones,
No,
you know,
yeah.
there are those of us out there that specialize in this. And so, get to somebody who's going to be able to give you accurate information quickly, because time is of the essence for some of these things. And we don't want you or baby suffering needlessly for weeks on end.
We don't believe in the wait and see.
Nope. We do not.
Nope, we don't do that approach.
Things don't usually resolve on their own.
Yeah. They turn into something else. They might look like they resolve, like, oh, their colic is gone.
It's an adaptation.
Exactly. It's like, what is that going to manifest as later in life that we'll see? And it might not be detrimental, right? It's not always this big and scary thing that it turns into, but there are nuances that we see with attention and concentration or motor skills or sleep or whatever, right? Breathing, like sleep apnea, all that stuff. Those are all reflections and manifestations of something that happened earlier with all of this stuff. And like when, you know, the first thing I hear when I hear a shallow latch is we're not only doing body work in the mouth, I'm looking at the pelvis too. I'm seeing, right, cranial sacral. There's a reason why it's so impactful. And we have to look at the whole body. It's not just what is the function of the mouth. Yes, we have to look at that. It's a key factor in it. Obviously. The other part of it though is looking at full body function too, because if we're tight and locked in, there's a reason why in labor they say don't clench your jaw because you're going to clench your pelvic floor. The same thing happens with babies too. Everybody has a pelvic floor, everybody has a jaw. They're all related to each other. And so you have to look at, you know, if we're tight and contracted in the pelvis, we're also going to be tight and contracted up here most likely. And so that's where looking at everything earlier can be really helpful.
And I think it's easy for adults to understand everything's connected. When I sit in a chair all day, I have this, right? When I stand all day, I have that. Why is this muscle group sore when I do this exercise that's for a different muscle group, right? Like adults are usually able to kind of tie these things together, but there's definitely a disconnect in how any of the same types of things could be happening with their baby. And I'm like, I get it. They don't have 20 years of muscle memory and they don't have sports injuries as a teenager and they didn't fall snowboarding 19 times last winter. You know, like you're right. Your baby does not have this stuff going on. Their systems are far more sensitive than ours. They're also far more resilient. So it takes a lot less in a baby to make a really huge difference. But it also means that something pretty subtle, one or two muscles not doing what they're supposed to do can have a really, really big impact on their system. And so, yes, just because they can't tell us they have pain.
I know.
So we do have to rely on the subtleties of their function. And if something's not functioning easily or well, there's usually a reason for it. And so and it does have the potential for long-term impact. And we don't want to see that. If it's avoidable.
So many great things. I love these conversations.
So our first list of 10 common questions.
Absolutely. So as I stated earlier when we started this, if you have any questions that pop up throughout this episode specifically too, pop them into the comments. We always took a look at them. We want to answer your questions. That's why we're here. That's why we started this podcast, because we want people to have good information, but also just have information in general, right? So then you know what direction to take. As always, thanks so much for listening.
We'll see you next time.
If you found today's episode helpful, you can subscribe, share it with a friend, or leave a review. It helps this podcast reach the families who need it most. You can find us at Belly Bliss in Denver and online for resources, workshops, and support. Until next time, take care of your body and trust its wisdom.